everybody. Welcome to today's episode of Oncology Data Advisor. Today, I have the pleasure of being joined by Dr. Erica Fortune from Cancer Support Community. So last week at the ASH annual meeting, the Cancer Support Community team presented their abstract, Perceptions of Treatment Tolerability and Its Relationship to Income in Patients with Hematologic Malignancy. And Erica is here today to tell us some more about this research. So Erica, thanks so much for coming on today.
Absolutely. Thanks for having me. Really excited to be here.
Definitely. To start off, would you like to introduce yourself and share what you do at CSC?
Sure. So I'm Erica Fortune, and I'm Vice President of our research team. We are a multidisciplinary set of professionals that conduct various types of research. We do what we call mixed methodology research because we firmly believe that the patient voice and data is not just found in one type of research. So we do a variety of different things, including surveys, interviews, focus groups, and beyond. And again, I do that with our multidisciplinary team. So we bring unique perspectives to the work that we do.
Awesome. Looking forward to hearing more about this research today. So for background, I would like to tell us what exactly is treatment tolerability and what are some of the different factors and considerations that go into it?
That is a perfect first question because that's really what this work is about. So traditionally, the widely accepted definition of treatment tolerability is really about the physical impact, right? And about adverse events that patients might experience during their treatment. But we know that doesn't fully encompass what the patient perspective is and how treatments might affect, for say, their quality of life, right? So really what we're looking at here is how do we define treatment tolerability within a patient space?
Amazing. So what exactly were you and your team investigating in this study?
Yeah, so to build on what I was just mentioning, we are looking at how patients perceive treatment tolerability in their cancer treatment. We were looking at factors that extend beyond our physical experiences and adverse events. So looking at things like cure and progression of a treatment, symptoms and side effects, but access, right? Things like convenience and cost and affordability of care, the well-being, right? So how does treatment affect well-being when it comes to the impact on their daily life, when it comes to their emotional experience and well-being, and then also the treatment regimen. So thinking deeply about how is the treatment given? Is it oral versus injection? Where is the treatment given? Is it at home or in clinic? And then how often is the treatment given? So these are all factors that influence the patient care experience and thus should be considered when we're thinking about tolerability. And I'll get into more of the details about those findings in a minute. But for tolerability specifically, we asked about 11 factors that touch on those points I just mentioned. And we asked patients, how important are these things to you when you're considering your treatment tolerability, right? And that's really at the base of what we're doing. How important are these things to you when you're considering tolerability? And I think the last thing I'll say about what we did specifically for ASH is that because this is a conference specific to blood cancers, right, hematologic malignancies mostly, we wanted to further understand how those specific patient populations, so those suffering from or living with a blood cancer diagnosis, would define treatment tolerability, what's important to them, especially because in that space of blood cancers, those treatments are incredibly costly, right? So there's a lot of factors to consider when we're thinking of tolerability beyond just the physical effects and adverse events. We also need to think about things like the patient perspective and cost.
Great, such important questions to ask, and it's great that you narrowed it down to blood cancer as well to see what the specific factors are. So I know in the study you looked at the Cancer Experience Registry. Would you like to tell us what this registry is and then how you used it for the study?
Yeah, I would love to. It's actually one of our longest standing research initiatives. So the Cancer Experience Registry is a research survey that aims to understand the emotional, physical, practical, and financial impact of cancer and identify unmet needs in patients, survivors, and caregivers. And again, it's one of our longest standing initiatives. It's actually been around for more than 15 years, or almost 15 years when we look at our original iteration. And then we recently revamped it. We wanted to make lots of enhancements and improvements. So in 2022, we did what we refer to as a relaunch of the Cancer Experience Registry. So again, this is open to anyone who's a patient, survivor, or caregiver, as long as they're 18 years or older, living in the US or Canada, impacted by any type of cancer, regardless of diagnosis and any time since diagnosis. So I think it's important to recognize that since we relaunched in 2022, we have more than 4,000 patients and survivors across cancer types and almost 1,000 caregivers in that Cancer Experience Registry. And we do ask about a variety of topics, right? So when I introduced what the registry is, I made sure to say that we touch on physical, emotional, financial, but even those labels aren't enough to fully encompass what the registry captures in the data. But for something like ASH and the work we're talking about today, what's amazing is that we already have those questions embedded into our Cancer Experience Registry. So we can say, all right, we want to understand this specific patient population better, and we want to understand tolerability. So we're able to extract that data from the registry for that purpose.
It's really such an amazing resource.
Thank you so much. I agree. I agree.
So what results did the analysis find in terms of relationship between income and treatment tolerability?
Yeah, excited to chat more about that. So for this specific research submission to ASH, there were 118 individuals who were part of this research. And it's, again, because we collect PAM cancer in the registry, it wasn't limited to one type of blood cancer. So the ASH submission is blood cancers, but not just one type. The most frequently reported blood cancers for this analysis were MDS, non-Hodgkin's lymphoma, and multiple myeloma. But we had several other blood cancer types represented as well. And we also had a good distribution of income, which is important because that was key to this specific analysis. So within this specific sample of 118 individuals, we had 20% who indicated they were making less than $40,000 a year for their household income. And then we had about 32% indicating they were bringing home between 40 and 100,000, 28% 100,000 or more, and then 20% preferred not to share. And I also want to take a moment to say, we always offer that as an option in the registry and our research because we know there are questions patients, caregivers may not feel comfortable answering. So we always leave that space to say, I do not want to share this with you, and that is absolutely acceptable. But for those individuals who did report their income, we really wanted to understand those differences between those making less than $40,000 a year and those making more than $40,000 a year. So that's the cut point that we use for this specific analysis. So when we're looking at tolerability, the number one finding is that regardless of income, the top 3 factors that patients said were the most important to them for treatment tolerability were ability to slow disease progression, treatment side effects, and symptom relief. But then there are some differences that emerge when we look at those income categories. So those reporting a lower income were more concerned than those reporting a higher income with cost and affordability, which certainly makes sense, how the treatment was given. So whether it was oral versus injection, and then how often the treatment is given. So those 3 differences didn't quite reach what we would call statistical significance in statistics, but we had 2 that did emerge as statistically significant. And so we found that the impact of treatment on emotional well-being and where in clinic or at home the treatment is given were significantly different between those with lower and higher income, such that those with lower income indicated the impact on emotional well-being was more important than people with higher income, as well as where the treatment is given. So again, for those of lower income, that was more important.
Great, thanks so much for the overview of all the findings. So did you find any of these results particularly striking or significant?
For me, as a researcher, I feel like everything always feels so important. But I will say one of the first reactions I had when I read it and really looked through the results and started to understand what they were saying was the importance of access to care and treatment considerations. So things like how treatment is given, where treatment is given, how often a treatment is given. These are essential to always consider in the patient experience and when it relates to tolerability, because it seems as though those are coming into play, right? When patients are going to say, yes, I would tolerate this treatment or would not tolerate this treatment, those things like access matter. And I think the underlying story there is this is a health equity issue, right? And it's always going to be a health equity issue. So we're looking at things like income and even beyond, right? Other important factors to consider. We need to understand what it's like across all patients and all experiences and keep that access and health equity top of mind. And I think the second point that really stuck out to me was the difference that emerged in the lower income versus higher income and the impact on emotional well-being, right? That there was in fact a difference there to be found really indicates that we need to be making sure to provide our patients, survivors, with support resources, right? So that should always be top of mind, and it shouldn't be something that is an extra, right? So the idea of supporting people emotionally should be something that is part of standard of care and part of a treatment plan from the beginning.
Absolutely, such important findings. So going into what you just mentioned about you said support services and resources, how can these findings be used to inform considerations and kind of take the next step into creating those?
Yeah, and I love that question. And I will say at Cancer Support Community, this is part of what we do, right? Is really work to not only understand what are the unmet needs, how can we better support our patients, survivors, and caregivers, but we also work to create the materials that do that. So
Mhm.
I would say, as far as considerations for support sources and services, just really taking care to understand what's out there, right? If you're a healthcare provider of any sort in that space, making sure number one, you recognize we need to provide support, and it's not just physical support or practical support. It extends beyond. It's financial support. It is emotional support. It's social support. And those things, again, should be embedded into the process, standard of care, and workflow from the very beginning. It should never be an add-on or an extra, or if we have time, it should just be part of the standard of care. So number one, recognizing that is essential. But then number two, looking to groups like Cancer Support Community or other advocacy groups who really work hard to capture the patient voice and embed them in our materials, our educational resources, our support programs. I think that's really where we can continue to make improvements.
Absolutely. So any next steps or future directions for this research?
I think yes. So this is really just the beginning of this tolerability research. So again, the Cancer Experience Registry itself, where these data are extracted from, that's been around for a while and it will continue to be around, hopefully. We continue to enroll patient survivors and caregivers on a daily basis. So with the tolerability data specifically, I want to continue to dive into that. So this is a newer area that we just started looking into in our data. So our numbers with the tolerability are continuing to grow. And for this specific submission, it was, again, blood cancer specific. But I want to understand how tolerability is seen in other patient populations, right? So do we see similarities across different types of diagnoses, across different types of cancer stages and cancer experiences? And do we see tolerability relate to other areas, right? Because the registry is so robust in what we include thematically, we have the ability to find the relationships between things like, let's say, healthcare team communication, right? Is there a relationship between tolerability and healthcare team communication or adherence, right? That's some of the other work that we've done in our research. So I think the next steps are to continue to enroll in our Cancer Experience Registry so that we're increasing our overall sample size and diversity of different populations of cancer communities, and then also see how tolerability might relate to other factors we have in our registry.
Absolutely, is a great important direction to explore as well. So as I wrap up today, any parting messages you might have either for clinicians about how they can incorporate this research into their practice or for patients who may be wondering how this research could affect their care?
Well, I'll start with the patient because that's always at the forefront of what we do and core to our mission. I think for patients, survivors, and caregivers, my take-home message would just be, we want to understand, right? We want to understand your experiences and we want to represent your voice. So any way that you're able to share that with us, we want to hear it. And then we want to be able to use that information to enhance and improve your care experience. That is what our core to our mission, right? And then for healthcare providers, it's just to, I think, take a moment and realize that this type of work is out there, right? This type of work is here. And I think it's key to understand that the findings that we have in this space, right, they extend beyond the physical impact. I know that's always at the forefront of healthcare providers' attention is how do I serve and protect the physical well-being of my patient, but also considering, again, the emotional well-being and other factors, and that groups like Cancer Support Community are here to help.
Absolutely, great message to close on. So thank you so much, Erica, for coming on today to tell us about this research. It was really wonderful to hear about.
Thank you so much.